Not all elbow pain is tennis elbow. It could be coming from your neck. In this video, I'm going to show you how to test both and how we're going to treat both. So this is Claire and she's got pain on the outside of her elbow. What I'm going to show you is how I would test for tennis elbow first. So tennis elbow is inflammation around the tendon, the extensor muscles for the wrist where they insert. So the pain would typically be right onto the outside of the elbow when you palpated it, a really specific location. Pain usually with lifting, gripping, pouring the kettle, draining the pan of pasta, that sort of thing. To test it, what I would do is I would get Claire to straighten her elbow. If you stretch your fingers out for me, can you push up with this finger? That would reproduce pain on the outside of the elbow. Pushing up with the middle finger, that would also reproduce pain here. And then if you bend your elbow for me, and you're going to squeeze my fingers as hard as you can, and that would also reproduce pain. And it would be really specific into this area on the outside of the elbow. Now, if the pain was a little bit more spread out around the forearm, so a bit more diffuse, it could be coming from a neck. So symptoms of radial nerve irritation can mimic lateral elbow pain or tennis elbow. So the radial nerve starts in the neck, it runs down the back of the humerus, so down the back of the arm here, tracks round the outside of the elbow and then through the forearm on a diagonal down towards the thumb. But usually when it's radial nerve irritation causing the elbow pain, the pain is slightly lower. So it's more into the forearm here, which is where the radial nerve runs. So to test that, we do something slightly different. So I would check through Claire's neck, check her range of movement and see if that reproduced any pain in her neck or referred any symptoms down her arm. One of the main tests that we need to do is what's called an upper limb tension test. So where we stress through the radial nerve and see if that reproduces any symptoms. So to do that, if you come a little bit closer to the edge, what we need to do is we depress the shoulder, so we apply some force downwards towards the feet to put stress through the brachial plexus. Then we're going to take the shoulder into abduction. We're going to rotate through the shoulder, flex through the wrist, and then extend and rotate. And if that reproduces any of the forearm or elbow symptoms, or there's a limit in the range of movement, it's more likely to be the radial nerve that's causing the symptoms rather than tennis elbow. So on Claire, she actually has positive tennis elbow tests. So when she grips and when she resists finger extension, they do reproduce pain on the outside of her elbow. However, the radial nerve tension test is also positive. So it could be that she has a little bit of irritation to both. So from a treatment perspective, what we want to do is make sure we cover all areas and not just focus around the elbow. So my treatment plan with Claire, I would actually start treatment around her neck and around the radial nerve and then retest her upper limb tension and the tennis elbow test to see if it changed rather than starting with the elbow treatment. Okay, so with Claire's symptoms, because I think there is some radial nerve involvement, I would start my treatment around the neck. So we want to increase blood flow to the nerves. We want to mobilise from that nerve root, so where it originates in the neck, all the way through the brachial plexus, through the back of the arm and down into the forearm. If I just treat around the elbow, I might change the symptoms, but I don't think that I'll get the carryover that we want because we've not actually addressed the root of the problem. So the radial nerve originates around C5, so kind of mid to lower portion of the neck. So what I would do is I would have a feel around the neck for mobility, if there's a difference between that left and right side, and as expected, it is quite stiff around that left side through those facet joints. So we want to do some nice soft tissue work through there to start to mobilise everything. So working through the SCM, working into rotation, so we're getting some movement through there as well. So I would always do some soft tissue work first before working into the joints to mobilise them. So yeah, we want to work all through the front of the neck, particularly through that SCM. Then what I would do is I would start to do some lateral glides through the joints into the neck. So we want to just gently start to mobilise through there. And when you're doing this, it's always worth asking if it's obviously reproducing any of the pain down the forearm and into the elbow. It doesn't always, but it can do. I would mobilise into those joints, and then what I would do is I would start to glide the nerves as they pass under the clavicle, so under the collarbone here. So we're going to glide through there and stretch through into rotation. With the radial nerve irritation, we don't know which part of the nerve is actually causing the problem. So it could be anything from the neck all the way down through the arm where it travels. So we want to make sure that we target all of it. Okay, so I've put Claire inside lying now, and we're going to do some mobilisations around her brachial plexus. So where the nerves come out of her neck, they then have to travel under the collarbone, under the pec and out under the armpit. So it's quite a big structure, it's a big bundle of nerves, and we want to mobilise it up, down, forwards and backwards essentially. So we're going to get some downward pressure through there. I'm going to go nice and light with this because it can be quite sore and irritable. Work up and down as well. Getting as much movement through there as we can. Then I would go into some specific radial nerve glides where it tracks around the back of the shoulder, comes down the humerus and then into the forearm. So we're going to work right into the back of the shoulder here, and we want to glide that nerve down towards the elbow. So pressure into it, and then we're mobilising and stretching it downwards. And I'd work the whole length of the nerve and just spend a little bit more time focusing on any areas that felt particularly sticky or like there wasn't as much movement in them. So I'd work all the way down the back of the humerus, and then I'd put Claire onto her back and work through that radial nerve as it comes round the elbow and into the forearm. But then I would also work medially, get as much movement in it as we can. And when I've worked all the way down towards Claire's thumb, so I know that I've covered the full length of the nerve, then I would retest a upper limb tension test to see if we've changed the elbow symptoms. So if you come right across to the side for me, it's the same as we did at the start. So I would depress through the elbow, shoulder out to the side, rotate. And you should get more movement after you've done that. So there should be a change to elbow symptoms when you retest that. Now with Claire, we've got way more movement. There's nowhere near as much resistance as I do that test. So that confirms that her elbow symptoms are more radial nerve irritation as opposed to tennis elbow. So when I'm treating around the elbow, what we want to do is find the main location of pain, which is usually right onto the lateral epicondyle, so onto the bony prominence on the outside of the elbow. So you can work into that tendon because we want to increase blood flow to that area, break down any adhesions, scar tissue that's in there, and you want to work in as many different directions as you can. What we need to do is picture that that is 3D tissue, it's not 2D, so we want to get to as many of those fibres as possible. It can be really sore, particularly if it's quite acute. So obviously the depth of treatment will vary dependent on severity and irritability of the symptoms. So I would work into the main site there. Now the tendon is where the extensor muscles, so the muscle belly is in the forearm, is where they attach into the elbow. So we want to work through the muscle belly as well. So same principles, we want to move through the tissue. We don't just want to work in one direction. So we're getting it to as many of those muscle fibres as we can. So rotating through the elbow as we're working, making sure we're increasing through pronation as I am doing now. And then I would work in the opposite direction. So we're getting into supination too. So you can pick the tissue up and work it around into supination there. Now this is where the radial nerve would start to run through. So it sits around the outside of the elbow, kind of 3 to 5 centimetres lower down the forearm, which is where the tunnel is, where the nerve runs. So if it is radial nerve irritation, that is usually where it's most sore. So when we're working into the nerves, what we want to do is make sure that they're gliding. So they should move almost like dental floss through a tooth. So they want to glide backwards and forwards, not just pulled in one direction. So we want to apply a little bit of pressure and glide that nerve through the forearm in the direction that we know that it runs. Again, we're increasing blood flow through that area, increasing mobility in as many different directions as we can. So when I've worked through all the soft tissues of the forearm and we've done the radial nerve work locally, I would retest. So we would get Claire to extend her elbow again. Can you push up through this finger? Obviously checking if that reproduces any symptoms through this one. And then bend the elbow and grip my fingers as hard as you can. And that should have changed what she's feeling around the outside of the elbow when we contract those muscles. Following treatment, I would expect that Claire will be a little bit sore where we've worked. Obviously, we have worked quite deep into the tissues around the muscles, around the nerves. So a little bit of bruising is perfectly normal for the first 24 to 48 hours after treatment. But her overall symptoms, so that elbow pain on the outside coming into the forearm, should improve straight away. So if you can relate to any of the things that we've discussed in this video, if you've got any symptoms in your elbow coming into the forearm, then do get in touch and we can give you the best advice on the management plan that's suitable for you.